In this video, and after reviewing the international recommendations for intubation of COVID-positive patients, we will be describing the different steps required to intubate the COVID-positive patient presenting to the operating room. These same steps shall be followed for any intubation on the COVID unit and any other intubation in the operating room. Please note that the steps can be modified depending on the severity, the difficulty, and the urgency of the situation, and of course, upon agreement between the different team members. On the COVID unit, 3 personnel wearing full personal protective equipment will be in the room during intubation, and the team will consist of an ICU nurse that is going to be handling the medication, an anesthesia resident or an attending, and an inhalation therapist that are going to be responsible for managing the airway and operating the ventilator. An anesthesia therapist will be present but will stay outside the room just to hand off any additional airway equipment or medication if needed. Here, just for the sake of time and simplicity, we're just going to demonstrate the intubation steps of COVID-positive patients presenting to us to the operating room. So we have a COVID-positive patient that's going to be coming here to the operating room. We're going to be operating in OR 10 since it's the negative pressure room. Okay, let's just do a little debriefing. Layal and I are going to be working on medications outside the room, and then we're going to bring whatever we need inside. Only Layal and I are going to be in the room during intubation and extubation. We're going to ask you to stay outside, just help us with any additional medication or airway equipment if we need them, just in a way to decrease contamination and to minimize exposure. So now we're going to go over the checklist. Is the machine checked? Yes. Okay, so we covered it with a plastic drape. We have filters on the inspiratory limb and the expiratory limb, and we have a filter between the circuit and the mask. The defend has been changed. We have a new capnography line, and we have changed the soda line between casings. Okay, so now let's go over the airway equipment. So the glidoscope is on, and this is the adequate size blade, and we can see through it, so this is working well. We have the adequate size tube with a stylet loaded in it. We have a 10 cc syringe to inflate the cuff, and we're going to have an airway just in case we need to ventilate. Remember, this is a rapid sequence induction. Okay, so we're not going to be ventilating unless we have to. And in case we need to ventilate, we're going to apply a wet gauze on the mouth and the nose and apply an adequate sieve just to prevent aerosolization of the particles. Okay? Suction is here and ready. We're only going to use it if we need it. Start by washing your hands with an alcohol-based solution. Next, wear your Tyvek suit. Followed by the blue impermeable gown. Tie it in a way that you can untie it at the end. Next, apply your N95 and perform the manual fit test. The upper strap should be above the ear, the lower strap should be on the neck. And then apply another face mask above it. Next step is wearing the eye protective shield, the eye goggles. The last step is wearing gloves. It's preferable to double glove at all times. Make sure your hands are covered and all your face is covered. And now you're ready to go. Okay, so now that we're ready to induce, we're going to ask all the personnel in the room to step out. Only the anesthesia attending and the anesthesia resident are going to stay in the room during intubation and extubation. Please assume that both of us are going to be wearing full personal protective equipment during these two steps. Patient will present to the OR with a 5 mask. Then we're going to apply the monitors, and we're going to be ready to start soon. So we're going to remove the mask and apply another mask on it. We're going to ask you to take a few deep breaths in and out. So we're going to apply the 2-mask seed just to prevent any leakage, and I'm going to induce. We start by giving the medications after 5 minutes of pre-oxygenation. We try to do 5 minutes of pre-oxygenation with low gas flow just to decrease contamination as well. So I'm going to start giving the propofol, and then we're going to do 1.5 milligram per kilo of lidocaine. I'm going to give you the rocuronium. And if you need to give opiates, it's preferable to give them after induction, after paralysis, just to decrease the risk of the cough reflex. Your medications are in. Once you're ready to intubate, we're going to pause the gas flow. I'm ready. I'm going to hand you this. And we're going to prepare the tube. And the gas flow is paused. You can go ahead. Tube is in. Okay, so I'm going to take your stylet out. We'll put it in the disposal bin. We'll inflate the cup and we'll connect the tube. Gas flow is going to be resumed. You have it inflated, so your tube is in. You might remove your first set of gloves and replace them while I tape the tube. Now we might ask the rest of the personnel to step in the room if they have to. All the contaminated equipment shall stay in that bin for disposal. So now that we're ready to extubate, we're going to ask everyone to step out of the room. Only the anesthesia attending and the anesthesia resident are going to be present for that step. Again, remember, they should be both wearing full personal protective equipment. So now that we're ready, it's advisable to keep the patient on Persidex, on remifentanil, and or give lidocaine 1.5 milligram per kilo, just to prevent bucking and coughing at the end of the procedure. Okay? So we're going to cover the head of the patient with a linen drape. We're going to have all the equipment ready. I'm going to give you the face mask of the patient. We're going to have the syringe ready. So once we're ready to extubate, we're going to pause the gas flow, remove the breathing tube, and then reapply the face mask. Okay? Yes. So now that the patient is ready, we're just going to pause the gas flow. I'm deflating the cup. I'm going to extubate and put the tube in the disposal bin while I give you the circuit to reconnect. And then we're going to resume the gas flow. Okay. The patient is breathing okay. So now we're going to describe removal of PPE. We're going to start by removing the outer set of gloves from outside till the inside. Next, remove the impermeable gown by tearing it from behind and folding it in. Take the inner set of gloves with it. Fold it and dispose it. Next, wash your hands with an alcohol-based solution. Remove the hood of the Tyvek and remove the whole Tyvek sheet and dispose it. Remember to wash your hands between each and every step. Next, remove your outer mask. Don't touch your face. Remove your goggles. Wipe them and conserve them in a plastic bag. You will have to keep your N95 until you come out of the room. To remove your N95, take out the strap, don't touch your face, and dispose it. Wash your hands with soap and water at the end of the procedure.